Dr. Erica Nason from Texas State University, who is going to talk to us about mental health for farmers. It's an issue that's been getting a lot more attention recently for really, really sad but very, very important reasons. And Dr. Nason, she's a professor at the School of Social Work at Texas State University, and I'm going to hand it over. Thank you so much for joining us.
Thank you for having me. I'm really happy to be here and to be talking about this project that we have going. So we are in about the third year of a 5-year grant through USDA NEFA. It's a workforce development grant. And we've been working with agriculture students in the state of Texas on building up mental health advocacy, providing skills and resources that can be taken throughout the state of Texas to hopefully address some of the mental health issues that we're seeing among farmers and agriculturalists. So a couple of really quick facts to put this in context. Research has shown that the suicide rate among farmers is higher than among any other occupational group. We know that there are a lot of external stressors affecting this group. Farm incomes are at their lowest. And we also know that just living in rural communities presents a lot of barriers to seeking mental health care. So over half of rural residents live in communities that have a shortage of mental health professionals. And I think there are something like 80% of the counties in Texas meet those criteria. Just putting that into context again, so comparing the farmer suicide rate to the suicide rate of the general population, opioid overdose deaths, homicide rates, you can see that the overall rate of death by suicide among farmers is really high, and we'd like to get that down, as well as improving mental health outcomes in general. And so when we think about mental health in agricultural communities, there are kind of a number of things that are also really unique that don't always create good solutions with traditional mechanisms of mental health intervention. So a lot of the stressors that we see tend to be things that folks don't have a lot of control over. So things like drought, tariffs, pests, they can all have a pretty significant impact on bottom lines and profits and overall day-to-day functioning of the farm itself. We know that farmers and agriculturalists also report being exposed to a lot of different types of traumatic events, everything from the mistreatment of animals to accidents involving farming equipment or the loss of crops, which can be really difficult. And then kind of taking a step back and looking at kind of the higher level issues, like I said, fewer mental health resources that generally exist, social isolation, so sometimes kind of being longer distances from social supports and things like that. And then also thinking about kind of just broadly attitudes about mental health and cultural values around self-sufficiency and independence that might make it less likely for this group of individuals to seek out mental health needs. And taking all of these things into consideration, we wanted to create a program that would develop essentially peer-to-peer supports around mental health. So we're recruiting agriculture students in Texas, with the idea being that upon graduation, they're going to enter into all of these farming and agriculture communities and be able to take the skills and the resources, the knowledge about resources with them. And a lot of times these peer-to-peer programs, individuals might have more credibility, more kind of cultural savvy than somebody who's a mental health professional coming in and trying to provide services. So some of the major goals that we have, we want to really understand some of the risk and resiliency factors that are present, as well as kind of identifying from the perspectives of these students what the specific barriers in their communities look like. But then we also want to really provide some concrete skills so that once they graduate, they go into these communities, and if they are noticing red flags associated with suicide or mental health distress, they have some tools in their toolbox that they can do. So we really emphasize being aware of local and national resources that are available, and not just traditional therapy or medication. So we do a lot of work around things like mobile mental health apps that are out there, that anyone can use anywhere. We also talk about tools like self-care tools that individuals can use for their own mental health support, as well as kind of easily talking about to other individuals, and then concrete tools for advocacy. So mental health can be hard to talk about. We do a lot of like role playing and things like that to help make that a more comfortable conversation, before our students might need it in a real life setting. So students come into our project and they submit an application, they enroll in the project. We have them do some pre-training coursework. This is really kind of getting a sense of what they already know about mental health. And then they complete a full day training with us. And we have students go through in cohorts, with the idea being that they'll form relationships with one another, they'll continue these conversations, and potentially kind of network and build relationships that can continue even after their participation in our program. So we collect some more information from them, but we really have an interactive day of training, and emphasize really forming this community. And they continue with us for a full learning semester, and during that time we meet on Zoom calls, and we do kind of consultation with the cohort. They complete webinars. So we have a menu of webinars on all sorts of mental health related topics. And then we also have them create an outreach project, and this can be anything of their choosing. So they can identify an area related to mental health or resiliency or risk that's of interest to them. And they also identify a population that they want to reach out to. And we've had a lot of really creative projects. It's been really fun to see what students come up with. We've had kind of more traditional outreach projects, like presenting a PowerPoint on self-care. I think we had a student who worked in a vet's office, and during their weekly staffing was able to do that. But we've had students really think outside of the box and use social media, and use even, I think one student used video games. So Animal Crossing, they created a whole mental health outreach event on their island. I don't know Animal Crossing very well, but it sounded very cool. And then we follow them out for a year, basically just to see how effective this training is, and to continue gathering information about what types of situations related to mental health they might be encountering once they've graduated and begun their careers. One kind of key piece is that we emphasize that students who go through this program aren't mental health professionals. They're not social workers, they're not psychologists. Their role is really to be mental health advocates. So our goal is for them to leave with a working knowledge of different types of skills and resources, a knowledge of what to do and who to reach out to in the event that they find themselves in a situation where they're really not sure what types of advice to give. And we also expect them to work to improve mental health outcomes within their community, to continue the advocacy after they graduate from our program. And part of that will hopefully also decrease some of the stigma around mental health, and the reluctance to talk about mental health, while increasing awareness. Let's see. We talk a lot early in the training about just kind of understanding beliefs about mental health. So these are some of the questions we pose to our participants as they come in, just thinking about where their beliefs about mental health come from, whether that's families, whether that's media more broadly, whether that's religious communities, and in the ways that that might kind of affect their behavior, both in positive and negative ways. And students have really done a great job of kind of thinking deeply about how that affects their behavior, like especially around how they might view their own mental health differently than somebody else's. So a lot of our students talk about like having reluctance to engage in mental health resources themselves, but thinking that other people, you know, if their friend or their sibling came to them with concerns, that their recommendation would be to engage in certain types of mental health support. And so this quote we pulled from the Red River Farm Network. They have a series of interviews up, but I think it kind of captures some of what we want to do. As much as we don't want to share our experiences with mental health, we need to. The stigma of suicide has been swept under the carpet, and not to talk about it. It is an illness like cancer, but there is help available. And so really one of our goals is starting that conversation and just creating a culture where folks are a little more open to talking about and thinking about mental health. We look at both risk and resilience, but we emphasize some of the resiliency factors associated with mental health. So the idea that we may be affected by mental health symptoms within our lifetime. In fact, it's more likely than not that we'll experience depression or anxiety or some other form of mental health symptom in our lifetime, but that there are things that we can do that help protect our mental health or help strengthen our mental health. And so we focus on kind of what are those positive adaptations that can be practiced or that can be used to help support individuals' mental health. One of the things we talk about, I mentioned earlier, is mobile applications. These are really great. The market has really expanded on these. A lot of them are available for free and are developed by some of the leading researchers in the country on various types of mental health interventions. A lot of them provide some psychoeducation, but I think a really key piece is teaching skills that can be used, whether that's practice of skills, helping people monitor progress, tracking behavior. So looking and seeing over time how behavior change can occur. And one that we focus on is called the virtual hope box. But some of the strengths are, again, there's a lot based on good research. They're really discreet. So if I pull out my cell phone, we all kind of carry our cell phones everywhere. If I pull my cell phone out while I'm waiting in line at the DMV, nobody knows that I'm working on my mental health. And I can kind of use that tool anywhere, any place in moments of distress or in moments where I just have a little bit of time. We have a handout that I'm happy to send to anybody with a list of really good mobile applications that are specific for different types of symptoms. There's everything from parenting skills to depression to post-traumatic stress disorder. And so I'm happy to send that to anybody. If you have interest, just shoot me an email and we can get that to you. So there's really a wide range of types of mobile applications, and they tend to be really user-friendly. They've gotten even better and better as technology improves and as, you know, coding for apps gets easier, I think, for people to work with. They can sometimes be a little bit tricky. Sometimes individuals don't have broadband or wireless access. There is no professional guidance for most of them. They could certainly be used in the context of a formal treatment. And it is kind of up and coming, so we're still looking at some of the research base. But like I said, one of the ones that we focus on is Virtual Hope Box. It was built specifically for suicide prevention, and there's really good research supporting its use, even in the absence of support from a therapist or counselor. And it contains a variety of different kind of skills. It's pretty user-friendly. It includes some stress reduction skills like relaxation or meditation, but it also includes a tool for coping skills where individuals can kind of identify specific situations that are difficult, identify skills that they can use in those situations, and kind of track progress with that. So just kind of one resource I wanted to make sure you all were aware of. we also, in addition to giving participants an overview of resources that are available kind of in communities that might lack access to mental health professionals, we want to give our participants practice talking and building skills around talking about mental health. So thinking about how to build rapport, how to build relationships. We spend a lot of time doing role plays, which I'm a psychologist. I work in a school of social work. So our graduate training, we do role plays all the time. Like, we're totally desensitized to it. Our first cohort that came through, my co-facilitator and I realized very quickly that this is not something agriculture students do very often. So we definitely kind of tapered our role plays to be much more stepped than they were initially. But it's been a really, really effective tool for having students kind of practice, like, how do you find out more information if you're worried about somebody. We created an acronym to help our advocates in the event that they do encounter a situation where they're really worried about somebody's mental health. So the first step, just kind of helping them get to know the problem. We do different role plays around all of these different skills, but a lot of these things are skills that our participants are doing naturally in their own relationships, but just kind of putting it in a context of a mental health crisis, potentially asking questions, being a really thoughtful listener, gathering the facts, just using your curiosity. We also help them kind of figure out how to review their options. So figuring out how high is the level of need, mental health, the stress that this person's in, thinking about what resilience factors do they already have that could be built on, asking if the other individual is willing to kind of have a discussion about mental health, so asking permission first. Thinking about outreach, so whether that's reaching back out to us and asking for resources if they don't know what to do or what to look for, looking for community resources, really kind of practicing that. And then the last step is working together, so really identifying a collaborative approach to problem solving. Over the past couple of years, we've definitely encountered some shifts in how we deliver. So COVID-19 has of course caused some shifts in the overall program. So we started out in person for all of our one-day trainings and things like that, and of course have had to shift online largely. So kind of changing how we talk about this in a virtual setting as compared to when we're all in the same room together. We've learned a lot about the benefits both to the participants and the communities. So like I said, we're following folks a year out from participating and looking at kind of the impacts on their own mental health, as well as kind of the outreach activities that they're continuing to do in their communities. And we're starting to see some really, really nice patterns where people are continuing advocacy and also experiencing some direct benefits to their own mental health. The community has been a really nice aspect. So because we're checking in throughout the course of a whole semester, we've had lots of students kind of build relationships with other individuals in their field and continue to communicate. Like, they all kind of create the group me's together and all of those kinds of things. And so, just kind of continuing to gather insights into mental health stressors. And I think, this work is started. I think there are other people out there starting to do some of these approaches to creatively addressing the problem of mental health distress in farming communities. But I think we have a long way to go. And so I think, as we kind of go, we're always looking to think about how else we can apply what we're seeing and how else we can develop resources that really address the problem. So we are kind of continually recruiting for the program. If anyone is affiliated with the university or has students in Texas who might be interested in participating, or I'm happy to kind of zoom into classrooms and talk about it with students and things of that nature. I'm also happy to talk more about the program with anybody here today. And this is all of our contact information. So both myself and then my co-investigator and co-facilitator, Abby Blankenship, who's at UT Health Science Center. And I'm happy to take any questions or have a little bit of a discussion now.
Yes, thank you, Dr. Nason. This is a very important topic, and it's great to know that you guys are working on finding ways to help out the farmers that grow and raise their food. So thank you for that. We have some questions for you from our attendees. And question number one is, why does farming present more mental health challenges than other professions?
Yeah, that's a good question. And I think I touched on this a little bit at the beginning. I think we still have research to do to understand really all of the factors that are at play, but I think some of it has to do with the types of stressors that farmers and agriculturalists encounter. So again, a lot of those stressors are really outside of an individual's control. Like I can't control whether I have a drought that affects my crop yield for the year. And those types of stressors, we know just kind of broadly tend to have more significant impacts on mental health as opposed to things that I can control, like the types of relationships I'm in or things like that. So I think those are some of the factors. I think some of it has to do with the lack of mental health resources within a lot of farming communities as well. So just not being able to access services even when there is a need. Those are probably some of the key things.
All right, thank you. Someone here said, excellent program and so needed. Can non-students listen in on program training?
Oh, that's a really interesting question. So I think the answer is probably, unfortunately, no, just because we are also a research program. So we have IRB approval and have to respect the confidentiality of our participants. But having said that, like, I think we'd be absolutely happy to talk about training or share any training materials with people if there is interest for kind of non-student stakeholders. Like there's enough interest, we could potentially even do a whole separate training.
All right. Okay, we have another one here. Again, they mentioned a very interesting topic. I understand now you taking for this. Okay. Do you have data on actual farmers experiencing mental health?
So our research lab does not currently have data on that, but there is data out there looking at, and I think it's growing data. So when we started this project, a lot of the data was actually out of Australia and India and China, which may or may not apply in the United States. There's a lot of different cultural factors. In the last couple of years, I've seen more of that data starting to come out, kind of getting a little bit more of a nuanced idea of what the rates of suicide are within this population and what some of the mental health symptoms are that kind of coexist with suicide risk.
All right, thanks. So we have about 4 more minutes, so we're gonna do a couple more questions. One says here, how about the rest of the family? Could that stress transfer to other members of the family? Is mental health even worse now that we are in the middle of a pandemic?
Absolutely to all of those questions. So we know that mental health of an individual affects, social connections and vice versa, but it works bidirectionally, right? So family members can also be one of those resiliency factors that can help somebody who might be experiencing anxiety or depression, for example. So we know that kind of the mental health of an individual and social support are really, really closely linked. And so I think looking at family interventions could definitely be an important avenue. And then absolutely, I think COVID-19, we're seeing just affect mental health across the board. So, you know, throughout the nation, we see opioid overdose deaths rising. We see distress across age groups, across professions. It's really strained mental health.
Yeah, for sure. Thank you. The last question I'm gonna read out here is there a hotline available for an individual that doesn't have internet or a smartphone?
Yeah, there are some hotlines available, and there is a USDA affiliated hotline that's available as well. I can always post some of those resources for folks who are interested. And then places like the, you know, National Suicide Hotline are always accessible. But there are also some local ones that can be helpful. SAMHSA has a great hotline that will help find substance use providers within a person's area. So there are definitely options for folks who don't have a smartphone.
All right. And of course, you provided your contact info, so anyone that is interested in getting more information, they can reach out to you.
Yes, absolutely. Please do.
And with